Good evening, everyone. I think we're going to go ahead and get started. Again, welcome. My name is Haley Thompson, and welcome to our third night of our second installation of the Community Engaged Research Symposium series, which is focusing this year on strengthening community academic research relationships. And I'll say a little bit more about that in a moment. Tonight, we're continuing our focus on Black health and racial equity with a focus on the digital divide. So I welcome you on behalf of Wayne State University and Checkup, the Center for Health Equity and Community Knowledge in Urban Populations. I also welcome you on behalf of Hermanos Cancer Institute and our Office for Cancer Health Equity and Community Engagement. So as you can see on the slide here, we are focused on the digital divide tonight. And I'm just going to ask, just as a little bit of housekeeping, that during the presentations, we have a lot of folks in the room, in the Zoom. So please try to keep your camera off during the presentations, and please, please, please remember to mute, because there can be a lot of background noise. So please mute yourselves during the presentations. We'll have a lot of opportunity during our breakout sessions to turn those back on and engage. And that's an important part of tonight, is engaging. Because tonight it's going to be a very interactive program. We're going to hear some fantastic speakers. You're going to go into breakout rooms, and we really want to hear from our communities about what you think the priorities are when it comes to African Americans, health, and the digital divide. And what we'll be able to do is, or what we want to do is, after this session, we want to continue this work. We want to take those priorities and have that be the foundation of a plan. And we want to keep working on that plan after the symposium has ended. So if you're interested in continuing this work and interested in one of those work groups, please, please, please contact Alex Sass at the website, or the address, the email address that you see on the slides. Again, we want to kind of continue this work. So the program is in the chat, so please take a look at the program. The link is in the chat of the Zoom. As part of that, you'll see our land acknowledgement and acknowledgement of the legacy of Native peoples. We went into this more in full a couple of days ago on the first night, and we have the full statement in the program. I just will say that Wayne State University affirms Indigenous sovereignty and it honors all tribes with a connection to Detroit. I also want to provide a radical welcome to our attendees who identify as transgender or gender nonconforming or non-binary. And we ask that people please be attentive to pronouns. Oftentimes people have their pronouns next to their names in the little within their Zoom box. We please ask everyone not to make assumptions about gender identity. And if you're not sure, feel free to use they, them, their pronouns. And with that, I want to thank everyone who's been involved in making this possible this evening. I particularly want to thank our checkup team, especially Alexandra Sass, who has been really at the forefront of keeping everything on track. I want to thank Chris Johns, who has just been invaluable behind the scenes. I want to thank our entire planning committee, who I know worked so hard to bring these 3 nights together. And I want to acknowledge the planning committee chairs, who I'm going to turn it over to now, Dr. Rhonda Daly, Lisa Braddox, and Winona Bynum. So I will turn it over to them at this time. Thank you, thank you, thank you for being a part of this experience.
Yes, well, good evening, everyone. Again, my name is Lisa Braddox, and like Dr. Thompson just said, I'm one of the 3 co-chairs of this symposium, and as well as I serve as the steering committee chair for Checkup, and certainly honored and privileged to do so, and really, really have enjoyed these last 2 evenings. We have grown a lot, we've learned a lot, and we're expecting no different from this evening's list of speakers that you'll hear from very shortly. I do want to allow everyone the opportunity to hear from my outstanding co-chairs for this symposium. If you had the opportunity to attend the previous 2 evenings of this symposium, you were able to hear about their work. more in detail, but I encourage you all, of course, to learn more about them and really, really get engaged with our work and have the opportunity to really support them in the work that they do moving forward. Check out the program, check out their bios, and check out the bios of everyone else who has been on the program over these past 2 evenings and even tonight, just to really, really dig deep and learn who they are, because we've got a lot of genius right here in Detroit, including yourself. So I'm grateful for the opportunity to serve in this capacity and to have you all be part of this symposium. Dr. Daly or Winona, would you like to just greet the people this evening? Go ahead, Winona, please.
Okay, we both. Yeah, so welcome everyone. So glad to have you here again. This has been wonderful to make space 3 nights in a row to talk about such important subjects. Like I said the first night, we could have had a whole month of evenings, but we so appreciate you spending time with us. And I think the most important thing is that there are a couple things, that the sharing, and then also the fact that this is not the end. So we will move these thoughts forward. We've been collecting ideas, and this is a welcome from Wayne State and Checkup to work together and move this work forward. So just so excited. I'll hand it over to Dr. Daly. Thank you for having me. This has been really great.
I just want to echo my counterparts, my partners in crime here, their sentiments on, it's been a lovely 3 nights so far. I'm pretty sure it's going to be just as lovely tonight as the other 2 nights. And again, just want to reiterate what they said about bringing everyone together and actually working on those action items, which are important to us.